A hearty welcome to my channel Kunjapan Sebastian. Today our topic is osteoporosis part 1, causes, symptoms and diagnosis. Osteoporosis is a disease affecting bones. It causes the bone mass or bone density to decrease substantially, rendering the bones weak, fragile, porous, lean and brittle. The bones of a patient having osteoporosis become so weak and brittle that a minor fall, bumping on something, bending over, coughing, or even sneezing can cause a bone to break. People with little or low intake or absorption of calcium are more susceptible to osteoporosis. Before proceeding further, may I request my viewers to kindly watch the video completely and like and subscribe to my channel, and it shall be highly appreciated. At the initial stages, this disease does not show any signs of symptoms, but when it has already weakened the bones, symptoms like back pain, loss of height, and a stopped posture become perceptible. In the absence of specific symptoms for this disease, people having this disease even do not know what they have the disease until they face a sudden fracture, usually at hip, wrist, or spine. The prevalence of osteoporosis and the incidence of fractures are much higher in women than men, and therefore it is labeled as a woman's disease. As it is difficult to diagnose and confirm osteoporosis based on the symptoms shown by the patient, it calls for a bone density test, especially of those who are at risk of getting this disease. A bone density test is done by X-rays and known as DEXA scan and is the most accurate test for confirming osteoporosis. The results of bone density test reveal the content of various minerals, particularly calcium and density of bones. Apart from confirming the disease, this test is useful to predict the chances of getting a fracture in future, the rate of loss of bone density, and the effectiveness of treatment also can be known. Now let us consider who are at risk of getting this disease to enable them to undergo diagnosis to detect the disease. They, they include postmenopausal women because of the sudden decrease in estrogen hormone, senior citizens with advancing age, those who smoke and drink alcohol excessively, those who having a family history of bone fractures, particularly hip fractures, and those who use steroids for long durations. Patients of diabetics, arthritis, liver and kidney diseases, and hyperthyroidism are also prone to this disease. Sex is another risk factor as women are more prone to this disease, especially when they are pregnant or breastfeeding, as the demand for calcium is high during these periods. Also, those who have a low body mass index (BMI) are at risk. As a token of acknowledgement that this presentation is useful, kindly like and subscribe to my channel, and it shall be highly appreciated. Thanks for watching. Bye till we meet again with part 2 of this episode.